All right. Well, welcome to our peer sharing call for June. I'm Kinkini Banerjee, the Coalition Relations Director at USBC, and I'm here with Miriam, our coalition's coordinator. Miriam, do you want to say a quick hello?
Hi everyone, this is Miriam.
So this is going to be our last TA call that we have. So this is a really good time, and if we can, talk a little bit about sustainability and how we can continue the work that you all have been doing in this amazing project. So why don't we get started with I just wanted to go over these logistics. I think most folks know. If you're having any audio issues, chat it in the box. Otherwise, let's just give to prevent any background sounds. If we can keep our mics muted when someone else is speaking, that improves the quality of the recording very much and also cuts out all the background sounds. So, so let's go ahead and do quick introductions. I'm sure you know how to use this. So if you don't, again, chat it in the box and we can let you know how to mute the sound. Right now I hear no feedback, so I'm guessing everything is good. So again, our meeting objectives are to connect with each other, share any updates and resources, discuss any plans that you have for the sustainability of the projects and efforts, and then surface any TA needs that relate to your Children's Healthy Weight CoIIN project or anything else that you're doing in your coalition, your states, and we'll see how we can, USBC can, work with you either on an individual basis or we can set up a group webinar topic, anything that works for you. So let's have a quick round of intros. Betsy, do you want to unmute your line, please?
Yes, hi there. Are we doing introductions?
Yes, if you can see the screen, it's name and then your organization, state, or coalition.
Okay, this is Betsy Dantasak. I'm in Louisiana with the Bureau of Family Health and also with the Louisiana Breastfeeding Coalition.
Wonderful. Welcome, Betsy.
Thank you.
Christine? Christine, your line might be muted.
I'm terribly sorry.
No
yes, hi. This is Christine Sassy from the Arkansas Department of Health WIC program and also from our State Breastfeeding Coalition.
Wonderful. Welcome, Christine. Diane?
Hi, this is Diane Bass. I am the nutrition program consultant here in the Children and Youth branch at the Division of Public Health, North Carolina. I have been the leader for our breastfeeding CoIIN here in North Carolina, and I also lead a similar group in North Carolina here at the Division of Public Health, which is our breastfeeding coordination team.
Wonderful.
So we have some of the same members, but not all of the same members.
Great. Good to have you, Diane.
Thank you.
Jacqueline?
Hi, my name is Jacqueline Bondi. I'm with the State of Nevada WIC program. I'm the statewide breastfeeding coordinator, and I'm the lead on the breastfeeding CoIIN project.
Welcome, Jacqueline. Kelly?
Hi, everyone. Kelly Stater here with the Wisconsin Department of Health Services and also our State Breastfeeding Coalition.
Welcome. Rosemary?
Hi, good afternoon. My name is Rosemary Casillas. I'm with the State of Nevada WIC Breastfeeding Program, the Peer Counselor Program Coordinator, and the President of the Southern Nevada Breastfeeding Coalition.
Wonderful. Welcome, Rosemary. And then we have NEOPD support. So do you want to go ahead and introduce yourself?
Linda Cowling, is that you?
Hi, this is Linda Cowling. I'm with the California Department of Public Health.
Hey, Linda, welcome.
Thank you.
Suzanne?
Hi, this is Suzanne Haydu. I'm also with California Department of Public Health. I'm with Maternal, Child, and Adolescent Health, and I'm the Nutrition and Physical Activity Coordinator. Thank you.
Welcome, Suzanne. Is there anyone on the phone that hasn't had a chance to introduce yourself yet?
This is Katie Jonke with Bismarck Burley Public Health in North Dakota as part of the North Dakota CoIIN team.
Welcome. All right. So it was so great to see some of you in Maryland last week, was it? Or was it 2 weeks ago? So we had a very successful advocacy day as well as a conference. So if you were there, one thing, I always come away from a conference feeling really full of gratitude for the folks who showed up and created the learning community that we had. But also as staff, we are running around so much, rushing around, that I never have a chance to sit down and have a proper conversation with so many of you. We are always racing around the place. So, but it was great to see your faces, even if I didn't have extended conversations. So we wanted to start with some USBC updates, and then we'd love to hear what's happening with your projects, what help you need as you wrap up, and how might we highlight the work that you do. We have many webinar series, we do spotlights, we feature state coalitions or state teams, and we'd love to find ways in which to spotlight and highlight your work. So I'll go through very quickly some of our resource lists. So Miriam, do you want to speak about our June Pride Month resource list?
Sure. Did you want to make me the presenter?
Sure. Miriam, can you make yourself the presenter? For some reason, I'm not able to change the setting. Oh, I am.
Okay, great. So here we are. Yeah, so we have been working on monthly observance pages, and this month, as you may know, is LGBTQ Pride Month, and we have added this to our page of other resources. So if you click through here, you'll see our page with a number of resources from breastfeeding support, a social media toolkit from Moms Rising, some information for transgender and binary parents, and a number of other resources, as well as a highlighted MBCC presentation that if you were able to be there with us, you might have caught, and personal gender pronouns, which we have on our website as well. So that's a list of our resources for this month. We are always, this is a page in progress at all times. So if we hear of any new resources, we will be able to add these as they come. So if you have anything to share, feel free to send those over.
And thank you, Miriam. Do you want to chat the link for this one? It's going to, the Weekly Wire is going to come out in a few hours, and so this is going to be in the Weekly Wire, but you all are getting a preview of some of the things we are going to highlight in the Wire this time. And if you can also give the link for the observances pages. And while we are waiting for that, if there are anyone who's joined us in the last couple minutes since we did the introductions, please go ahead and introduce yourselves. I think I saw Robbie join and one more. Did I?
This is Stephanie Trust. Oh, sorry. Hi, this is Robbie Gonzalez Dow with the California Breastfeeding Coalition.
Wonderful. Welcome, Robbie. And Stephanie?
This is Stephanie Trusty. I work with the Iowa team at the Iowa Department of Public Health.
Wonderful. Thank you. So for those of you who just joined, we are briefly going over some USBC updates. So June is Pride Month, and we've curated some resources for you, on gender inclusive language, but also on breastfeeding for the LGBTQIA community. We also, at the National Breastfeeding Conference last week, we had Stephanie Carroll, who's the chair of our conference program committee, did an amazing presentation on breastfeeding and support. So we've also included her slides there. And Miriam, did you want to also put the link for the other page, just show the other pages as well? Thank you. So for these, for the last year, for all of these, for Black History Month, for National Arab Heritage Month, Asian American, Native Hawaiian, Pacific Islander Month, we also have one on emergency preparedness, National Preparedness Month, Hispanic Heritage Month, and Native American Heritage Month. We curated a lot of info and updated these pages, but what we do is, instead of highlighting it just that for that one single month, we keep updating the pages as we come across information. If for coalitions that have created anything, we got North Carolina actually had some great stuff, I think, on Arabic language, things that the coalition shared with us. So we really highlight where the resources are being done and have link you to the pages for those coalitions or those organizations that have created it. So these are living pages. So if you have anything that you want to go, you'll see national observances is on your coalition learning connection, and Miriam has also chatted the link for it. So feel free to use these resources widely, share about them, but also add to them if you come across anything that's missing from this page and you might have a resource. Wonderful. Thank you. Miriam, while you're on the web, did you also want to talk about the BPHP toolkit?
Yeah, absolutely. So another project we've been working on is the Breastfeeding Public Health Partners Toolkit. We have a really lovely introduction here that tells you more about how this project got started and what our goal is here with this. We have a link to the coalition's directory that's easily accessible from this page. And here are our partners who each have their page and have worked with us to update the information for them. So if we click through any of these, we have their mission, their funding, their current programs, and any additional resources that they wanted us to include on here.
Thank you, Miriam. So the Breastfeeding Public Health Partners is funded by the CDC, part of the work plan that is part of USBC's, and NACHO is the one, the National Association of County and City Health Officials, that convenes this group together. So we have NACHO, ASTO, Association of State Territorial Health Officials, Carolina Global Breastfeeding Institute, National WIC Association, AMCHIP, the Association of Maternal Child Health. So there are about 9 such national organizations that come together, and basically we are any national organization that's federally funded right now. We meet every month and coordinate our activities as well. So besides just sharing updates with each other, we make sure that sometimes there's redundancy and 2 national groups are working on the same thing, and then we realize there's gaps somewhere. So this way we really want to make sure that we are coordinating and collaborating and working to to make sure that, with the federal investments in breastfeeding, that we are covering all of the bases. So a big part of our work is, so while this toolkit is part of that group, and the purpose of this toolkit was that often the state health departments don't know about the breastfeeding coalitions, and the breastfeeding coalitions don't, some have strong connections with their state and local health departments, but some don't. And so sometimes you have a state releasing a blueprint and they haven't involved the coalition at all. They don't know of the coalition's existence, or the coalition doesn't have any contacts within the state health departments. It's mostly hospital folks or who've come together and formed a state coalition, but they don't have those connections. So part of this public health partners toolkit is to make sure that we are connecting with the state, the health departments, public health departments are connecting with the coalitions, and the coalitions know which division within the state health department might be doing some of the breastfeeding funded work. So while there are, if you look at your state fact sheets, which is in the advocacy, you see what kind of federal funds for breastfeeding you have. But while you could go to the CGBI website and see what they are doing, and you can go to the National WIC Association, and you can go to the ASPH, and this toolkit kind of has a list of all of the national groups. And so again, this is something that we are building up, all of the resources that they've created in their breastfeeding work, the webinars series that they've created, or resources are also listed here. So please, again, we haven't done a huge launch of this. We are still working on it. Danae and I will be presenting at the NATO Annual Conference in Orlando next on July 9th, and we'll be unveiling this then. But we are racing now with our partners to make sure that the pages that we are housing these pages, because we have the platform to do that, but we are making sure that we are doing justice to the partners. So again, feel free to just check out these pages and see where the tax dollars and the federal funds go. We are also thinking of adding organizations who currently don't get federal funds, like CHAMPS or CHEER, that are funded by the Kellogg Foundation, or CGBI, which gets money from the Duke Endowment, but they are doing amazing work. So while we are listing mostly the federal funds, eventually we want to highlight this and list all kinds of money, private and federal, that is going, and state, that's going into breastfeeding investments across the nation. But just some great resources in there. So feel free to check it out and use, and give us some early input if you can about what you think based on your user feedback. We'd love to update it and refine it so that it's helpful to you. Awesome.
So I had a question.
Sure.
It seems like all the organizations are like national organizations that cover all the states, and then you have the Carolina breastfeeding, whatever they are.
Yeah.
And it just seems different. Like, we don't have the UC Davis Human Lactation Center, or it just seems that it seems like an oddity to the other group. And I just was wondering, is this group open to other organizations then, and what are the criteria?
Yeah, I mean, I think our group is, in terms of who we should involve and things, that should not be, much of an issue as we think about it and add folks to. The CGBI was added because they were the holders of the maternity care practices, that national team for the 10 steps, like they were funded by CDC to do that on the national collaborative for the 10 steps and even the national collaborative for early childcare. So because though they were regional in that sense, but they had a national presence, they were part of this group. But yes and yes. So if for the folks from California, if there's any interest for UC Davis Human Lactation Center, and they do get federal funds, right? State and federal funds.
I have no idea what funding they have.
So take care.
I don't.
All right.
They do get state funding, and I think even from other state WIC programs, and she might have some funding from other federal locations.
Mm-hmm. Right now, we don't have any universities or academia, and that's definitely something that would add a lot of richness because they bring so much with the breastfeeding report card. And I see that Karen Farley has the teachers join. Okay, maybe your line is muted, Karen. Okay. Well, so feel free to, is that the link for the toolkit, Miriam, in the chat box? Okay, so, hello. Did anyone just join us?
Trial.
Okay.
Trial.
I'm hearing, are you hearing?
Trial.
I think this happened once when we were having a conference call. I think it's Karen. I think
trial.
Your computer is saying trial.
All right. Well, Karen, we'll wait for your audio to get sorted so we can hear from you. So these were and then Pride Month resource list, the BPHP toolkit. So the MPING survey, I had sent an email out on the coalition Learning Connection about, the MPING survey was supposed to end tomorrow. In the past years, we've had about 83 to 85% of birthing hospitals participate in this survey. And so far, as of 10 days ago, there were only 55% of birthing hospitals that had completed the survey. So CDC was, really urgently asking all, stakeholders at the local and state levels to connect with the area hospitals and ask if they had completed. If not, to urge them to participate in the survey. So we had sent the link and some information out. And we just heard from them yesterday that they are extending the MPING survey to July 15th. We'd still, that blurb again is going out in the weekly wire, but we can, if you didn't see it on the Coalition Learning Connection, let me know and I'll send that information to you. We really need to have as many hospitals that can. So though it's been extended, we don't want the hospitals to wait until the end. So go ahead, and if they could do that, that would be great. Do you have the, yes? Hey, Ruby.
Does that link, do they have the list of hospitals? Because it was helpful. Somebody sent me the list of hospitals, and it was good to see that there weren't actually a lot of California hospitals, a handful. So it was easy to connect with people personally. That's helpful to have that list.
Yeah, I think I can give you Doris's email. Go ahead, Suzanne.
That was, I sent out, I did a screenshot when I was at USBC. CDC let me take a screenshot of the hospitals that they have not been able to get the survey to. They can't release the list of the hospitals that have not completed the survey. Only the hospitals, and some hospitals may have completed the survey but not done it correctly. So virtually all hospitals need to contact that. There's an email address, and they all need to contact it and see if their survey's been submitted correctly.
Yeah, I think that you're right that they didn't want to make the list public of which hospitals have participated, which have not. But two things we could do. One is, do you mind, Miriam, resending that email that was sent on the coalition listserv to this group and just say deadline extended, but the rest of the info stays the same so you can see the active links and the email. But also you could possibly contact Doris and she might be at least able to say, to give some broad generalizations that, hey, this county in your state has a few hospitals that hasn't done without naming the names. So we can send you, can you also send Doris's email, include Doris's email on that, Miriam? We can do a, post meeting email with giving you all of this information. So let's do that. So this is like really crucial. In the next 2 weeks, we need to have many, many more hospitals complete the survey. Any other questions on MPING? Diane, you said that you couldn't access the toolkit link. You might need to be logged in on the USBC website. So if you're not logged in, maybe that's why the link is not working. Okay, next is that the HRSA just did a resource on breastfeeding benefits. So this is again coming out in the weekly wire. We put a link for it. So go ahead and this is a good one that you can check out. Couple of webinars. The June Collective Impact webinar, which was on Tuesday, we had the California Breastfeeding Coalition, Dr. Ernalyn Navarro from California, talk about collaboration. It was an outstanding webinar. So if you did not attend it, participate live, again, we'll send the link for it. CBC is doing amazing work in really building relationships and focusing on collaboration. So that's really important. Robbie, Karen, Suzanne, did you want to add anything about this approach that's used so well, and how much your summit and the work of your teams is improved with this approach?
I'm still not sure what the question is.
Anything that you, yeah, I was speaking about what you guys are doing, and I'd love to hear you, having someone else talk about your work.
Is this based on Ernie's presentation that she did?
Yes, and it's that approach that you have of really focusing on building that, the relationship.
Hers was focused on, we always prioritize connection before content, and part of that is to have collective impact work is to take the time to build community and to build relationships. So that has been a focus at our summits in the webinar that our past chair did this past week. She presented some tools around how to do that and examples of how we have integrated connection before content into our big statewide summit, because it is possible to do that even with large groups, even to when we have small work group webinars, but to just emphasize how important the relationships are and making connections with people to build community. And her background is organizational development, and so she comes with that skill, and so she's been using her talents to further the coalition's work. And even though she's not a board member anymore, because they can serve 6 years, she can come back, that she's still contributing and participating on the summit in that part. But I think with any kind of work that we do, it is about building relationships and building community, and always trying to figure out how to do it well. With, even we're struggling to how do we build good online communities, and we're trying to learn about that right now, and how to further the work past a statewide summit, how to keep continually building the community around a certain topic. So that's something that we're still, working through.
Thank you, Robbie. And we found that so helpful too, because, we convene a lot of virtual groups, and you all with your state teams sometimes not meeting each other in person, but working virtually. And that intentional focus on trust building, relationship building just makes the collaborative work so much richer. So we learned so much from that. And yes, we'll put the link for the June 25th webinar in the chat box. And then July 17th is the Power Tools webinar, and this time we are doing a session on evaluation. And mostly I think we are used to doing the evaluation where we said, yes, like we did 4 webinars and there were 800 participants on it, and we did this paper and we did that. So in checking off, like, what were some of those, but how is it making a difference? How do you evaluate complex adaptive systems? How do you do systems level evaluation? So that's going to be a really great webinar. We hope to send the announcement for it next week, early next week. But again, if you've attended any Power Tools webinar, you're automatically registered for the whole series. So you'll get a reminder 1 week before, 1 day before, and 1 hour before the Power Tools webinar as well. So both of these should hopefully be really helpful, not just for these projects that you're doing, but for your other work as well. Ooh, and this is, we just got this news. So CHAMPS, or CHEER, as you know, is this initiative that runs out of the Boston Medical the Boston Medical Center, and Ann Muirwood leads that. So their CHAMPS in Mississippi program has been making a huge difference in that state. When they went in, there were no baby-friendly hospitals, and now I think they have half of the hospitals, or more than half, in these last 3 years have achieved designation, and there are more on the way. But for the first time in the nation, they are doing an interprofessional education module in breastfeeding. So all 7 schools of the University of Mississippi Medical Center are involved in that School of Nursing, dentistry, pharmacy, medicine, population health, and as well as the graduate studies. And they are going to be doing, so the med school faculty will be providing some of the, content on the other parts of, on their subject, but CHAMPS and CHEER team will be providing the breastfeeding expertise on that. And so they will be doing a unit with real life scenarios of prenatal skin to skin, and many other scenarios in the postpartum setting as well. And they are looking for actors to be doing that. So Anne asked me to share this widely. Again, it's coming out in the Weekly Wire. That'll go out in a couple of hours. But if any of you have histrionic skills and have, scenarios that you're already working on, like, it would be a good thing to contact them and see how you might be able to work with doing some role plays and enact real life scenarios. So that would be, we'll look out in the Weekly Wire for more info on that. And then the USBC learning community. So definitely for those who are member organizations, we have these topic-specific learning communities, and based on your engagement level, if your coalition or state is core involved in certain areas, maternity care practice or continuity of care or workplace, you've automatically been, you've automatically been assigned those learning communities and been added to that. So look out for info coming about that as well. But we might be starting a couple of new ones. We already have a learning community that is on women in incarceration. That's growing. We will have something on emergency preparedness too, because with all the storms and natural disasters and fires that are happening, especially in some of the other states, it's a grim realization that the infant feeding and breastfeeding support or any kind of cogent plan for infant feeding help for families is very, very lacking. So we'll be doing a learning community on that. And again, feel free to, if these topics are of interest to you, you'll see an email go out from USBC. Call us, let us know, and we can loop you into these spaces. So again, you have Miriam and my emails, but when you see an email go out from the USBC, there's usually a link of how to join, what to do, how you can. But if you need any further support, we are here to help you.
This is Suzanne. So back to that one. So at the USBC, there was the lunchtime discussions on that Friday during the meeting.
Yes.
And were those lunchtime group discussions learning communities, or were they? I wasn't quite sure exactly what they were, but I was supposed to do the other professionals, and then we combined it with the physicians.
Yeah. So
we did it together. Then I was going, I wish I knew about that CHAMPS thing at the time.
No, the CHAMPS thing just came out. They got their funding announcement, right? And the interprofessional education sounds like, so we'll hear from Anne Muirwood. We might even have her do, share some more details as we get it. So I had the press release and I had an email, but we'll definitely see how we can spread the word around, and if these modules are being done in one state, how they could be used by other health providers and for wider use. But to your question about what was at the membership meeting. Yeah, go ahead.
Yeah, and my thing is that most of us are somehow work with ASPH, and that they're obviously the CoIIN, and that's public health nutritionists, and so RDs and nutritionists. It's those other professionals is seeing how they fit in here, and I'm not sure there is a learning community for them.
Right now, we do not have one because we surveyed our membership to see which ones do you think can be listed, all of the topics, and said which ones are you most involved in or most interested in, even if you're not involved in it, which one would you? And we, based on the 4 or 5 that kind of rose to the surface, those are the ones we are convening, but we are always looking. It's a capacity thing. We are looking for folks, and if somebody else wants to take the lead and convene something, we might be able to, like, provide you the logistical support, so we can see how that would work. But yes, right now those are the ones. And but conversations or informal groups that are kind of coming together to do, um, we can definitely convene those. So Suzanne, in the other healthcare provider fields with dietitians, IBCLCs, if there's any chess, health education specialists, if there's any interest, like, let us know, and we'll see how we can make that happen. So what, yeah, and the lunchtime conversations that we had at the USBC member meetings was just so that the folks who were in the room and had said they were interested in a topic, we wanted to give some time for informal networking. But what we are trying to do is, because of our focus on equity, we want to make sure that a lot of real business doesn't happen only in in-person meetings, because then those who can't come to DC miss out on the on portions of the work. So most of where we are strategizing, or we are doing a lot of concerted action prioritizing, or we only do it during our virtual conversations, but we wanted to have folks engage in these in an informal networking kind of way during the membership meeting. Any other questions? Okay. So, big news. It is again going out in the Weekly Wire, but last night the Fairness for Breastfeeding Mothers Act passed. So it's now on the president's desk for to sign. It's going to, so this had already passed the House, and the Fairness for Breastfeeding Mothers Act is a pretty, what we thought was a low-hanging piece of legislation, but has been taking so long. It was any federal public building that has a restroom that allows for visitors to come in and use certain public buildings should also, the bill specifies that they should also have a private lactation nursing space for visitors there. And the reason this was important was for parents on the go, not to have a space where you can pump. Lots of folks in jobs that are like you're a bus driver or you're on the move. There is no space for parents. So this would make federal buildings that have public restrooms accessible to visitors, accessible for nursing space as well. So that's really a great, it's a happy day. You all signed on to the letter that was sent. There was a sign-on letter that was sent on Advocacy Day for those of folks who were on the Hill. This was one of the big things we were pushing, so it's really good news. And then the appropriations news, I know that our CWA folks and our state folks, you all are up to date on this, but the House funded the WIC peer counselor program at the full $90 million that was asked. The overall WIC, there's slightly less because of the less caseload, but generally that's great. So the big push now is that when the Senate does it, that they keep to the same levels, and that they pass what the House did. So there are two sign-on letters that USBC signed on behalf of all of our networks and our members. One was a letter from TIFA, that is that please raise the budget caps, although and that so that vital programs will be funded for fiscal year 20 and 21 at the levels that are needed. So this was from Trust for America's Health. And then the other one was that, the public health and prevention funds have been steadily cut over the last few years. When the Affordable Care Act passed in 2010, the plan was to have the public health prevention funds be stepwise increased to $2 billion by 2015 and then stay at $2 billion. So it's never reached the 2 billion point. It's been, eroded and eroded. So there was another joint letter that was sent, again signed by many 180 organizations, that asked that the funds be restored. And just yesterday, both Senator Blumenthal and Representative Matsui from Blumenthal is from Connecticut, Matsui is from California, introduced the legislation to fund the public health at $2 billion. So again, if you might see some action alerts from USBC to make sure that we all send that out as the Senate does its appropriations. We want to make sure all of these elements of public health, WIC, SNAP, children's nutrition, other benefits, housing, all of that are kept intact in the Senate version as well. So keep your eyes peeled for any action alert that comes out. And then finally, there's a new bill that was introduced on Wednesday, and this is from, oh my gosh, I'm blanking out on this. It is the Small Airports Breastfeeding Bill. Miriam, do you remember who the sponsor is? So you know that the FAM Act passed, which is like all, large, all airports should have a nursing space, but it exempted small airports from doing that. And so this one is a bill that says that small airports would have 2 more years. The FAM Act was part of the airport reauthorization, so there's a certain date by that. So the small airports extends that by 2 years, but it says that a nursing lactation space for small airports as well. So we feel like this would be help to normalize breastfeeding, also help with many rural communities where there are smaller airports. So we were contacted by the representative staffer on Tuesday, a day before yesterday, and we've got a sign-on letter that and an action tool, and that's going out in today's weekly wire as well. So please, if you get it, sign it on. It's coming on the floor today or tomorrow or early next week, but they really want to do that. So this is hopefully we can get some good support for this one as well. So lots of updates. Any questions? And we'll send all of this to you in a follow-up email. So you don't have to remember this. Much of it is coming out in the weekly wire, but some of the MPing and the links for the National Observance Month, the Pride Month, BPHP Toolkit, all of that we'll send you. So, gosh, lots of time taken up by USBC today. So these are again some of the things that we'd be happy to support you with your projects, but let me know how we can, any updates from you all and how things are going as you wrap up. Like I said, this is our last peer sharing call, but we hope that for USBC, though through the CoIIN, we won't be doing any more calls, but you have my number, you have Miriam's number, you have the USBC staff. Our job is to support all of your projects. So whether it's individual or group TA, so feel free to get in touch with us, but let me know how your wrap up of the breastfeeding initiative projects are going. Anyone want to share?
This is Jackie in Nevada. So we really aren't wrapping up our project at this point. We're working on finalizing a lesson plan to incorporate fathers into our WIC services at this point in time. So just fine tuning that. We're receiving additional training, and then we're going to launch that and several other initiatives statewide and just try to incorporate father support and inclusion into our regular WIC services. So it's ongoing.
That's wonderful. And that was a campaign that Nevada did too, right? So we will, maybe Miriam, we can add the slides for the robe, the Reaching Our Brothers Everywhere session that happened in the, there was a really good panel on fathers and partners at the National Breastfeeding Conference, and we'll add resources that came out of there in the follow-up email if that would help you, Nevada.
That's wonderful. Yes, I would so appreciate that.
You got it.
This is Robbie. I'd like to mention that also the California WIC Association has a toolkit on their website that's around fathers. Karen, are you still there? Because it's focused on WIC.
That would be awesome. Let's, okay, so is it on your website, Karen?
Remember, Karen had a problem with her voice that it starts.
Okay.
Yeah, saying
or
stuff.
she could chat it.
Okay.
Yeah. Oh yeah, she said yes. She'll send the link.
Awesome. We'll make sure then to promote that when we do the robe thing, as well as many other resources that we can club together and share. That would be great. So this is for the WIC initiative. We'll do that.
And I was going to say that California is still continuing too. We decided for our nutrition component, we're actually doing infant feeding for the next year, but we decided to continue working on our lactation accommodation while we're meeting, because we're all breastfeeding people. And so the things that we're working on right now is we are subcontracting with Jane Heinig to do the final edits on our increasing breastfeeding in the low-wage work site. This was something that came out in 2007, and we're doubling the size from 4 pages to 8 pages. We have a comprehensive perinatal services program with about, 1,600 providers in the state, and we're doing a little training, a 5-minute, 10-minute lactation accommodation training that'll go online, but anyone would be able to view it.
Fantastic.
We're also working on World Breastfeeding Week. We did a campaign last year, and we're updating that. And it seems like there was one other thing we were doing, but I'm going blank.
Evaluation of our work group for the statewide.
Yeah, so we are working jointly with a high-level lactation accommodation work group, which is now run by the California Breastfeeding Coalition and California WIC Association, and we're trying to make it into one of those AMCHIP best practices, and so we're in the middle of doing the evaluation for that.
Wonderful.
And we'll be meeting with them. Yeah.
Okay. That's the innovation station. So yes, if as many of this great, some of the work here could go into the best practices or the other levels, that would be great. Any other sharing?
This is Diane from North Carolina. I feel like our CoIIN is sort of figuring out what it's doing next. We already had a Division of Public Health breastfeeding coordination team, and our CoIIN really mirrored that, with the exception of course, the requirement to add in our MCH director. And so our focus for the CoIIN was on fathers. Our coordination team for the division is really just trying to sort of stay or keep on the same page with all the breastfeeding activities going on in the state. And then I guess just to add some complexity, and perhaps other states feel this as well, our state is one of the CDC funded states. And so, there are some requirements within that funding to have a breastfeeding advisory team. And so and that's with outside partners. So I think we're all just trying to sort of figure out how to work better together, not have 5,000 meetings that semi-overlap, but maybe have slightly different purposes, and continue, again, trying to work better together. So I guess I'd say that's sort of the status for our CoIIN and other breastfeeding work.
Yeah, and that's so important, Diane. So that's a good thing, because sometimes it's like, a lot of work, and just the coordinating between the different overlapping, and which ones complement and which ones can, that's so important to take the time to discern that. So
Thank you.
wonderful. Yeah.
Yes, this is Christine from Arkansas, and I could go next.
Please, go ahead, Christine.
Okay. Well, following up from North Carolina, I'll mention that one of the things I was going to talk about is that as we've looked at our partners and who's doing what and different limitations among each of the partners, one thing that we're trying to do, well, that we actually initiated last month, was to our coalition and our health department. It's not really a health department entity, but our health department has what's called a breastfeeding task force, which I facilitate. And over the last year, I had been looking at how much we had overlap, yet the goals were different, yet there was so much overlap. And what we are experimenting with and began last month was to not try to completely merge the groups, but to at least bring them together. And we did that actually, like physically bringing them together. We will now hold our task force meeting, and right on the heels of it ending, we will go into our coalition meeting.
Wow.
So in that way, each is, those people who weren't interacting, or where we can see, the task force can provide this, where the coalition can provide this, that, we can take information that went right from one group straight into the next group, and we're hoping that can bring some more of the people together. Again, a little bit of an experiment, but that's what we began last month, and we'll see how that continues to work.
That's wonderful.
So,
keep us posted, Christine.
Definitely.
Yeah.
Definitely, yes. I think it's going to be a good thing, and we'll have some hiccups, but I think those are going to be more technical issues rather than programmatic issues. So that's progressing, and otherwise it's the same. We're not really turning away from our project. We're going to continue to work, but there'll be some shifts. We are looking more at some faith-based initiatives. Our leader of the CoIIN, Kenya, is headed more in that direction, and our other partners, we're seeing where we can fill in the gaps there. So we'll kind of see where that leads. But for now, what we're really doing is just trying to get the message out about what we've done, and not just tell people what we've done, but give them actionable steps where they can take our work and try to reproduce or learn from it. So just 2 weeks from now, Kenya and I will be presenting on all that we've done for our state lactation symposium that's put on by our medical center and our breastfeeding coalition, and we'll discuss different components of the CoIIN, including the workplace accommodations, what we did, and then also I'll cover the segment on looking at the early child care setting, and again, not just telling the audience what they already know, but helping to show how they can work with their mothers of getting through those hurdles of when they go into the early child care environment and what they can do if they want to be advocates in that realm. So we have a little bit of a dog and pony show that we're taking and making sure everybody gets the message of how they can keep replicating parts of what we've begun here.
That's fantastic. And just know that if you're doing a dog and pony show, there's the USVC webinar. And what we keep telling all our partners is that we really love highlighting emerging things. So it doesn't have to be perfect and show that, it has all of this success, even if it's something that's experimental that you're doing, that you're trying to do it. We can feature that in the Power Tools and look at the process that you're doing. So all of the state teams here, again, we would really like to highlight your work in some way or the other. So if you, in the email that we send following that, we'll kind of give you a nudge. If there's any interest to share about it on a USBC webinar, we'd be happy to set that up for you. We have, sometimes we have speakers lined up for a few months, but we always have space as well. So let's.
Okay.
Wonderful.
Yes, that sounds interesting. Okay, thank you.
Thank you. Anyone else? I know we're over time, but I want to make sure everyone has a chance to share.
This is Betsy in Louisiana. I can give a real quick update.
Thanks, Betsy. Go ahead.
Yeah. So we developed the lactation accommodation statewide work group that meets quarterly as a result of this grant, and expanded our workplace breastfeeding support program, which was really located in the New Orleans area, so expanded that statewide. And our work will continue as well past the CoIIN, and that's due to our strong partnership with Well Ahead, which is a well spot designation program. So they've been a real champion for us in moving things forward through the state. So we'll continue, some of the things we want to continue to strengthen and really work on is mainly reaching employers of low-wage earners. Mm-hmm. So that's our charge going forward, and we'll continue to meet with the partnerships that we've established and look forward to continuing our progress. Thank you for all that you all have done, Aspen and USBC and supporting this effort and this grant.
You all are doing amazing work in your state, so thank you for that, Betsy. And again, the TA or the support continues. So our constellation year, we have Liz Morris and Jess Lee from the Center for Work-Life Law at the UC Berkeley have been working a lot on the workplace. And again, many of them, ACLU, Galen Sherwin, they are happy to work with state stakeholders as well. So anytime you're working on any of these, if you need connections or contacts and want to connect with any of them to explore things, figure out next step strategies, or give them feedback as well. Their emails I can share any of the workplace Constellation folks' email so that you can contact them directly. You don't even have to go through us. You can do that. Anyone else? Okay, well, thanks so much. And if there's interest in this group, again, we'll, though this is our last call, we'll continue to curate any materials that come in. And if you're interested, especially because we know which, what some of the state interests are, fathers and families. Do you want Miriam and I to maintain this group listing so that we can send you any resources that come our way? What is your preference? We don't want to clog your inboxes. But if there's something that comes in, do you want to keep the mailing list going?
Emails are fine with me. This is Betsy.
Okay, we'll try to be spare and not do any redundancy. So, well, great. Thanks, everyone. And, we are looking forward to following the state teams as part as you move into the nutrition component of it too. So can't wait to find out more about how that is working out. We realize that it'll take a few months for the projects to crystallize, and but keep us posted, and we will keep you send a follow-up email with all of the information that we shared today. So thanks. It's been so much fun working with you all, and this is, although this portion, your work continues, and so we'll be here, in any spirit of partnership that works for you.
Thank you.
Thank you so much. Bye-bye.
Thank you. Bye.
Thank you.